Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, and thanks for joining me back in the Sunflower House. On today's podcast, in May of 2023, in fact, we're just on the verge of a long holiday weekend. I thought it would be a really good time to go over tips on how to save money on medications, costly medications, and just regular medications. This is something that my team in the Center for Specialized Women's Health, the nurses, the administrative assistants, our fellows, our nurse practitioners, colleagues I have, we deal with this with our patients on almost a daily basis. And unfortunately, it's taken up more of the office visit time than in the past. And that's because prescription medications have gone up quite a bit, in part because of the middlemen, the pharmacy benefit managers. And so I'm going to go over a column that was recently posted by our wonderful new lead nurse in the center, Alexandria De Los Santos. And she's an RN and has her BSN. And she's so busy right now helping patients and doing what's called prior authorizations that I wasn't able to actually interview her live, but hopefully we'll be able to get her on this podcast. But she's really, really working hard, and it does seem like it's become more and more of a challenge. One of our first columns was written by some of our former center nurses who have gone on to other nursing opportunities closer to home. Many of you may remember Julianne Pesic and also Amanda Schutera. And probably one of the most frequently recommended columns that I recommend to my personal patients, and really anyone who's interested in saving money, is tips on how to save money on medications. And there are several ways to save money on prescription medications. And many people certainly look for ways to save money. But unfortunately, up to 45% of Americans have trouble paying for their prescriptions. And 26% of Americans simply do not even fill their medications because they can't afford it. And actually, I found out about ways to order actually brand name medications from Canada Drug from some of my Medicare patients. And I don't know if you had the chance to tune into one of our recent podcasts on how to select your Medicare supplemental when it comes time for that. But my Medicare patients certainly have taught me a lot. And it's quite poignant and upsetting when someone tells you, Doc, it's either I buy my food or my medications, or I can't buy all my medications and I have to pick and choose. So it's really critical for everyone to understand this very complex system and how to try to get better prices. And the price that you pay at your local pharmacy may be very different from another pharmacy that's just a block down the road. And both insured and uninsured patients can get better prices on prescription medications by using some of these helpful tips. Number one, medication discount cards. When you visit your physician's office, be on the lookout for any discount cards that might be displayed. My retired nurse, Lily, who I've interviewed about her retirement on this podcast, and my current nurse, Lily Beth, frequently will update and stock information in the exam rooms for patients. And some medication discount cards can allow you to purchase certain medications for 15 to 40% off. And many times there'll be local pharmaceutical representatives that visit the office of doctors to help promote and save patients money on their prescription medicines. The second option is cost-saving medication websites. GoodRx.com is a website. Sometimes I sarcastically say they offer crumbs from the pharmacy benefit managers. But nonetheless, as long as there's discounts and coupons and money to be saved, I definitely recommend it. And it's a website that does offer medications on where the medicine is located for the cheapest price in your zip code area. And it does offer other ways to become a somewhat smarter consumer when it comes to filling your prescriptions. So all you have to do is go on www.goodrx.com and just put in the medicine that's prescribed along with your location to see a list of pharmacies in the area. And it's really quite shocking to see the wide variety of cost of the same medicines. And you can get a really quick overview on this website of the medication, the prices, some listed side effects, and saving tips. Number 3, drug manufacturer websites. Drug manufacturer websites also offer discount coupons that you can print off or text to yourself and take to the pharmacy. You can go to the manufacturer website and may be able to save hundreds of dollars per year. Routinely checking the manufacturer's website to see if there's new coupons or saving cards. Or if a certain hormone replacement drug is not covered under the prescription tier of your insurance company, maybe going to the manufacturer's website might be an alternative way of still getting the medication that you want at that cost. And one of the medications that a lot of our midlife women wanted to get, which we're hoping is going to be back on the market in June, although we've been hearing that for like 3 years, is Duave, which is basidoxifene, which is conjugated estrogen with basidoxifene, which for progestin intolerant women, can certainly be an option. The number 4 tip is to contact your insurance company. If you get to the pharmacy and find out that a drug is just not covered or just too expensive, you can contact your insurance company, and they may be able to have some helpful tips or at least give you a list of medicines that are covered under the formulary or prescription tier for your insurance. And many times it's these pharmacy benefit managers that actually control the formularies, and they're the middlemen, which really affects competition in the free market. It's always a good idea before visiting any physician for you to know what your insurance covers and what the suggested formularies are. The 5th option is to choose a generic medication because generic medications may be cheaper, usually but not always accomplish the same outcome. And it really depends on the medication that you're talking about and what is the range, the dose range for effectiveness, because generics can be 80% equivalent to brand to as much as 125%. And if it's a medicine like, say, penicillin that has a wide range of a therapeutic dose, that doesn't matter. But if it's a hormone or something that even just tiny picograms of difference can make a clinical effect, or if it's a very critical medication, then sometimes the brand name is better. And there are patients who do respond to brand names better. But in general, most people do very well on generics and like saving the money. So one example of something that we prescribe almost every day is generic estradiol estrogen tablets. And in bulk can be as inexpensive as $10 to $30 per month. The problem with oral estrogen is it must be taken twice a day because it's a short half-life. And that's one of the more common errors that I see when physicians prescribe it is they only prescribe it once a day instead of twice a day. Generic progesterone, which is commercially available as Prometrium, the brand name, which is progesterone in peanut oil in 2 different doses, 100 milligrams and 200 milligrams, is also available generically and generally needed if there's a uterus or endometrium. And that is about $20 to $30 per month, a cash price. Now, many times we may prescribe a medication, hormones, blood pressure medicines, cholesterol medicines, and as long as it's not time released, cut the pill or the patch in half. And that can save you half of the medications. Now, sometimes what I do is I actually prescribe it as a full patch, but I tell the patient, and I write it in the written instructions that I give the patient, to cut it in half. Because if you write the prescription to cut it in half, many times the pharmacist will only dispense half the amount, so then you don't get the cost savings. Some patients don't like to cut medications in half. There are pill splitters that you can get, and that can be helpful. Number 6, and this is one that I've increasingly used, and I certainly hope we can continue to use it. And again, currently this is an option. Obviously, laws can change, regulations can change, relations between different countries can change. So it is somewhat of a moving target. Previously, it was prohibited, but it has been reinstated that Americans can get their prescriptions online on various Canada drug websites. And many times we'll print out the prescription or handwrite the prescription and have the patient take a picture of the medicine and then just upload it right onto these Canadian drug websites. And many times purchase the same medication by the same manufacturer for a much lower cost. And just a few of the websites you might want to bookmark and check out: northdrugstore.com, totalcaremart.com, northwestpharmacy.com, and ycdscc.com. And I have certainly personally had experience with all 4 of these sites. And when I personally have been prescribed medications myself that have been pretty cheap in the past, but have just exponentially risen in cost, I have checked out the website, and not all the time, but many times it's much less expensive. Now, in general, any kind of controlled prescription, that means when the prescriber has to use their Drug Enforcement Administration DEA number, usually you cannot purchase those medications across country lines. Also, testosterone, which is not a controlled drug, but certainly in the state of Ohio, is tracked on our ORA system, and is another common medication that we prescribe that cannot be obtained on any of these Canada drug sites. And insurance coverage and medication prices change frequently, so you really should be proactive. You should take charge, and you should maintain your awareness. You should definitely be a consumer, and you have to realize that sometimes the cash price of buying the medicine is actually cheaper than, quote, going through your insurance. In fact, I give the example of a antiviral medicine. You might be prescribed a 5-day course and be in line at the same pharmacy and, quote, use your insurance card, and you might pay $150 even with your insurance for the medication. But the same day, same prescription, the next person may come in and just not use their insurance card and say, hey, pharmacist, I would like to pay cash for this, and get the same medicine, same dose, same manufacturer for $50. And so going through your insurance or only being stuck to your formulary isn't necessarily binding. But it's also important to realize that this may be simply what people are used to or what is covered. And we cannot make your insurance company cover medicines. We can certainly give the diagnosis codes and give the reasons medically why you may prefer or do better on one than another. But unfortunately, that's not a guarantee for coverage. And whether somebody has governmental insurance like Medicare or Medicaid or the military TRICARE versus private insurance also has an effect on what is or is not covered. So I think it's important to prioritize your financial needs, because in some cases it may be worth it to pay more for a certain medication and just forgo your latest, purse or trip or outfit. On the other hand, less expensive generic medications may work just as well for you and allow you to put money away for a rainy day or other needs. And certainly, I appreciate the work of our lead nurse, Alexandria De Los Santos, and you can read her column that's posted on speakingofwomenshealth.com. And she's a care coordinator in our Center for Specialized Women's Health, and she helps our patients move through menopause with ease and confidence. And she started working with our team at the end of 2022, and she wants to build longitudinal relationships with our patients through their menopausal journey. And she also is the lead nurse that customizes and works on our custom fit physicals for women, which is a concierge program, and that allows 1 hour access with a physician and pre-scheduling and coordination of events and appointments for an upfront charge that is not covered by insurance. And in future podcasts, we're going to be going into other systems of care. We touched on it a little bit on the podcast on picking your Medicare supplemental, and certainly depending on what medications you're on, if you are on Medicare, going for a less expensive supplemental if you're on expensive biologic medicines may actually cost you a lot more in the end. And so that's really something worth getting educated on and considering. And we just barely touched on the new emerging practice option of kind of getting all the middlemen out of the office space, insurance companies, PBMs, other organizations, and just going back to the old days of the physician-patient interaction alone in the exam room. And direct primary care is gaining in some locales, concierge medicine. In fact, some of my graduated fellows, like Dr. Tuff DeSapri, is offering that type of practice in Illinois. And we did a great interview with her on osteoporosis and bone health. That was for continuing medical education for physicians, but I still encourage all to listen to that, particularly if you're interested in bone health and calcium and all the different therapies that are available. So Alexandria, who wrote the column on saving money on your medicines, she started out her nursing career in colorectal surgery at the Cleveland Clinic, and then she transitioned into management. And she got her bachelor's of science in nursing at Notre Dame College, where she's also a national delegate for National Student Nurses Association. And she is a dog lover and has some really cute pictures of her puppy.
We'll be back after a quick break.
Hey, quick question for you. Are you someone who wants to be fit, healthy, and happy? And what if I told you could get your dream body by simply just listening to a podcast? I'm Josh.
And I'm KG, and we're the hosts of the Fit, Healthy, and Happy podcast.
Listen, we get it. Fitness isn't easy. Carbs, no carbs.
Just stop, okay? It doesn't have to be that complicated. And that's why we made this podcast. We get straight to the facts so you can become your best you.
So the way to check us out is click the link in the show notes or search Fit, Healthy, and Happy podcast on any of the major podcast platforms. We'll see you soon.
So some other topics that we can go along with is, what does pharmacy benefit manager stand for? And I jokingly say in many states it means programs bilking millions. And in general, pharmacy benefit managers are supposed to help keep the cost for both payers and patients and lower out-of-cost pockets costs for plan members. But as a team of investigative journalists with the Columbus Dispatch has revealed, some pharmacy benefit managers are really skimming hundreds of millions of dollars in Ohio alone, boosting medication costs for everyone. And they market themselves as keen negotiators, able to squeeze pharmaceutical manufacturers for better deals that save money for patients, insurers, and society. But when they're middlemen and they don't add any value, and they're able to use legalized kickbacks through a loophole in a Medicare law called Safe Harbor, that could increase costs and affect the free market and lead to lack of fiduciary responsibility for their customers. And so many on all sides of the aisle, many patients, many non-political people have called for no more middlemen. And I wrote a column on our website, speakingwomen'shealth.com, and I updated it a couple of times, titled No More Middlemen, Reduce Drug Costs and Stop Medication Shortages. And why is there an increase in these medication costs, which I alluded to at the beginning of this podcast? Well, I've read about heart-wrenching stories about a young man with type 1 diabetes who recently died from preventable ketoacidosis. And he had type 1 diabetes, and the cost of life-saving insulin has skyrocketed. And so a lot of patients like himself was just parsing out the amount of insulin he had until his next paycheck so he could afford his life-saving insulin. And he died 3 days before he was to get his next paycheck. And so in my 3-decade career in the field of medicine, I've certainly seen the emergence of these middlemen who control the market, group purchasing organizations, GPOs at the hospital level, and PBMs, pharmacy benefit managers related to medicines. And this loophole in a federal law that allows for these legalized kickbacks allow them to control the market and increase costs, and also lead to drug shortages of critical medications. And in the past, it wasn't legal to get medications through cheaper sources like Canada Drug, but hopefully it will remain that is able to be done and pay cash and not go through the PBMs. So what can we do about this? Well, I think everyone should lobby their legislators to repeal safe harbor. And it's important, even if cost is not an issue or you're not even on medications, drug shortages can happen. And when there's not lidocaine or normal saline or life-saving medications that anyone may need at any future time, it's very dangerous. It's very easy to contact your U.S. senators and your U.S. House of Representatives. You can email them. You can just Google it. You can text them or call them. It takes just a few minutes. And it is a bipartisan issue. It really affects everyone. And unfortunately, both sides of the aisle are lobbied by these PBMs and get campaign contributions. And I think that's one of the reasons why this has stayed in place. So, if we can repeal this, I think we can reduce healthcare costs. I think if we can put the patient and consumer more in control of where their health care dollars go, I think that can help. We've certainly seen dangerous shortages of medications and even baby formula. That's been in the news. It's been estimated by eliminating these kickbacks in the healthcare supply chain, we could save between $30 and $90 billion. And if we can restore the drug marketplace so that inexpensive and available generic medications can be safely made. I mean, when the active pharmaceutical ingredients are made offshore in other countries such as China and India, we don't have the same quality controls. As you may recall, when Zantac over-the-counter, a common antacid medication, was recalled, they found that there had been cancer-containing contaminants in the APIs made off-site. And so having generic manufacturing in the United States can allow for more competition, better prices, and more availability of life-saving medications, antibiotics, supplies. We want competition. It creates lower prices and abundant supplies and better quality. But when you have middlemen, it can inflate prices and cause scarcity. There's a short little video if you like to learn things by watching things about safe harbor repeal of the benefit manager. And you can actually go on speakingwomen'shealth.com and just put in pharmacy benefit manager, and you can search for why we want this repealed. And I think that's kind of educational and helpful because it's very complex. It's certainly not a sexy topic, but it really, really, really affects all of us, and it certainly affects my practice on a daily basis. Now, talking about medications, is how you take your medicines important? It certainly is. One of our graduated fellows, Dr. Manisha Yadav, who is in San Francisco treating patients, wrote a really good column over a decade ago on how you take your medications. And so she started off the column talking about how one of our nurses recounted the story of a patient who was told to take an antibiotic for an ear infection, but put the tablet in the ear instead of swallowing it, because there's lots of different ways you can take medicines: by mouth, by drops in the eyes, the ears, by the skin, by the vagina, by the rectum. Another patient who had eardrops for swimmer's ear, but took it orally instead of putting the drops in the ear canal. And I remember the story that Nurse Mary told us, and Nurse Mary retired from our center several years ago and is also enjoying a well-deserved retirement. She told the story of a patient who had called to complain that the bed sheets were turning purple because she was told to use contraceptive jelly for contraception, and she actually just got grape jelly instead of the actual over-the-counter spermicide. So everyone can make mistakes on how to take medication, even physicians and nurses themselves. And there's a lot of different steps between how your prescriber is writing the prescription, to how it's transposed or communicated, to what the pharmacy or pharmacy tech dispenses, to what's on the label, to what the person themselves does. So I always ask my patients to bring in all their medicines or boxes or patches or gels, supplements, so we can take a look to see if there's any interaction, to find out how they're actually taking it. And so there can be very dramatic examples of what can happen if the doctor and the patient and the pharmacist and everybody doesn't understand themselves. And we have thousands of new medications which enable important options. I have seen patients who've been on oral bone medications and were distressed to find out they lost bone mineral density. And if it's not taken correctly, you can just be flushing your medicine literally down the toilet. And one example of that is with oral bisphosphonates, like Actonel or Fosamax or Beniva. These medicines are delayed release. They're not absorbed if there's other food. They have to be taken upright with a full glass of water. Otherwise, anything else that's taken with them can cause you not to absorb the medicine. Calcium, which is many times recommended for lactose intolerant women, people who avoid dairy. You can't take all the calcium all at once because the stomach and intestines can't absorb it all at once. Thyroid medicine is another common medicine. 1 in 8 women are on thyroid. It really should be taken first thing in the morning and nothing else. No other supplements or food or medicines within 30 to 60 minutes. Cholesterol-lowering medicines should be generally taken in the evening because that's when your body makes the most cholesterol. And some medicines that cause relaxation or sleepiness, like natural progesterone, prometrium, should definitely be taken in the evening. So the next time that you're in your doctor's office, take charge of your health. Be sure to understand exactly how you are to take your medications. If there's any conflict with what your pharmacist tells you versus your physician, you need to check back in with your physician or nurse practitioner or prescriber, because they generally have the last word for sure. And if you're allergic to any substance, it's very important to make sure that you understand this, that your healthcare team does as well. And it's important to read labels because just because something's over the counter doesn't make it safe. If you're pregnant or think you might be pregnant, or if you're breastfeeding, you're in really a special protected elevated class. And we're talking about 2 patients here. And there's unfortunately only a relatively small list of substances and medicines that are completely 100% safe in pregnancy and breastfeeding.
We'll be back after a quick break.
Have you ever experienced fitness failure? You know, you set a goal to exercise, you're all excited, and then you're not. Hi, I'm Dave. I host the daily 10-minute podcast, Walking is Fitness. Instead of an exercise goal, I talk about making a fitness promise. And every day you keep that promise, you add another link to a growing fitness chain. This is a podcast of action. You'll create a fitness habit, which eventually becomes fitness momentum, and then on to all kinds of good stuff. Check it out. Walking is Fitness, and let's take a daily 10-minute walk together.
If you have any trouble taking medicine, swallowing pills, some people cannot swallow pills. Some medications that are primarily pill form can be given in liquid form. You should always know if you're on very critical medications that can have interactions or overdoses, such as insulin, Coumadin. Some people will wear medical identification bracelets. Even some younger patients I've seen have it tattooed on them. Some people get a pill box and find that can be very helpful, especially if they have unusual ways or different days that they have to take medicines on different days. Unfortunately, some people stop medicine early or too soon when they're feeling better because they want to, quote, save it for the next time. And that is not a good idea. It's important to finish out your full course. If you want to have extra medicine on hand for a future bladder infection or future vaginal infection, that's fine. Just ask your doctor up front at your visit for a refill or an extra prescription to have on hand. Please follow labels specifically. Some medicines need to be taken with food. Some should be on an empty stomach. If you're taking medicine with water, you want to take enough water to swallow the pills. You don't want them stuck in your esophagus. Generally, you should not break or crush or chew your medicines unless you've been specifically instructed to do so. You don't want to share your medicines with other people. That's being a doctor and a pharmacist without a license, and that's potentially very dangerous. Be honest with your physician if you're trying to decrease your medicines simply to save money or sparse it out, because all those tips at the beginning of the podcast on how to save money on your medicines is very important. It's important to take medicines the same day, same time of day, to keep a constant level. Up and down levels of hormones can cause bleeding, can cause migraine headaches. Keep track and put little ticklers in your calendar about when you need to refill your medicines. If it's a mail order pharmacy, it may take a week or more to get. If you're getting your medications from one of these Canada drug sites we talked about, it can be a month or more. Sometimes there's supply chain issues. We've been running into that a lot more recently. I think if it's a critical life-saving medicine, it's good to have extra and not just the bare minimum. Storage guidelines are also important. Generally, it needs to be in a dry area that's away from direct light, heat, or extreme temperatures. It's important to not leave your medicines in a hot car for any length of time. In terms of storing it near damp places in the kitchen or the bathroom, that's not such a good idea. Some medicines need to be stored in the refrigerator, but most do not. And critically, it's important to keep medications out of the reach of children. Some medication pill bottles are more difficult to open to make them childproof, but they're not always childproof. And a lot of older people or people that might have arthritis or have some sort of decreased grip strength, many times we'll put the cap on the other way, which makes it very easy for others to get into it. Always keep your medicines generally in the original container and keep track of the expiration dates. And certainly there's specific ways that you have to dispose of addictive medicines like opiates and narcotics. If you're traveling, it's best to keep your medicine in the original container in your carry-on luggage. In general, probably you shouldn't pack your medications in checked luggage in case your suitcase is lost. I think it's a good idea to bring extra medication with you when you travel in case your flight is delayed and you need to stay away longer than usual. You need to have a good relationship with your pharmacist. Some people in my practice spend half the year in Ohio during the great weather like we're having now, and they spend the other half the year, say, in Florida or a southern climate. And you want to make sure that your pharmacies speak to each other and will give you refills or transfer the prescription. Questions to ask about medicines. Anytime you start taking any new medication, what is the generic name and what is the brand name? How often do you need to take it? Why are you taking it? What time of day should you take it? Do you need it on an empty stomach or with food? Some medications like progesterone are better absorbed with food. Many medications like osteoporosis medicines are like Actonel or Fosamax, alendronate, or Cidronate, or the generic names, many times need to be taken on an empty stomach. Where should you store the medicine? What do you do if you miss a dose? And how long will it take to know if it's working? What side effects should you expect? Is there any activities like driving or working with technical machinery or other activities that you should not do? Also, there's a lot of food and medication interactions and alcohol interactions or interactions between drugs. And the more complicated your medical regimen is, the more important it is to have attention to these issues. And it's also important if you see a lot of different physicians and nurse practitioners that they understand what you're on, because if they don't know, they may end up prescribing other medications. So if it's very important to be proactive with both medications and supplements, and also to be a consumer and be as proactive as possible. And this will help you be strong and be healthy and be in charge for yourself and your loved ones. So thanks so much for joining me in the Sunflower House. In the future, we're going to have a guest podcaster, Sylvia Morrison, who's contributed to some columns and recipes on speakingofwomenshealth.com. She is a retired marketing executive who worked with me when we took over the digital and entire Speaking of Women's Health program, including back when we had these big all-day events of edutainment. And she's since retired and has an excellent voice and loves to read. And in order to continue to bring you regular content and also get a break from just hearing my voice, we're going to bring Sylvia into the Sunflower House. So please be sure to subscribe to our podcast. Many of my patients tell me, oh, they just go on the website, but you won't get automatic notifications if you don't subscribe. So anywhere where you can get podcasts, there's so many different free podcast apps: Podbean, Apple iTunes, Google Podcasts, Stitcher, Amazon Music, Pandora's Box, any of these places that you like to listen to podcasts. Just hit the subscribe button and please give us a 5-star rating so we can move up in the ratings. I'd like to thank my tireless, talented executive producer, Lee Kleckar, who helps line up these topics, and also interviewees. I know a lot of you enjoy listening to the back and forth banter, as well as my whole team, all the nurses. We're wrapping up the month of May, which is Mother's Day, and celebrating nurses. And so have a wonderful time until I see you back in the Sunflower House. This is your host, Dr. Holly Thacker, signing off of our Speaking of Women's Health podcast. Until next time.